Hi, I'm Tammy Alexander. I work for the Cabarrus Health Alliance as the lead school nurse. I'm typically assigned to Mary Frances Wall. I currently am working with the COVID response in doing some clinical investigations and contact tracing. Most of the time when people test positive for COVID-19, they're able to stay at home and manage their symptoms. If you're a Cabarrus County resident, you will receive a call from the Cabarrus Health Alliance, and you'll be given some instructions on isolating. What that means is that you need to stay at home, and you need to stay away from anyone in your house who is healthy and not COVID positive for a minimum of 10 days. The other part of that isolation is going to be that you have to be fever-free without medication for at least 3 days with an improvement of your respiratory symptoms. So if you test positive for COVID, you get an isolation order that tells you to stay at home for at least 10 days. And the reason for that is to protect others in your household as well as others in the community. Make sure you monitor your symptoms. If your symptoms are worsening, you want to contact your healthcare provider so that you can get instructions. You always want to call ahead prior to going to any type of medical facility. Let them know that you have had a diagnosis of COVID-19. So we're finding that some people are asymptomatic, although they do have positive tests for COVID-19. If you have a positive test and you live in Cabarrus County, again, you'll receive a call from the Cabarrus Health Alliance. Your instructions will be to put yourself in isolation, so staying at home for a minimum of 10 days after your test date. If you were to develop symptoms, it's important that you follow up with your primary care provider and also with the Cabarrus Health Alliance, and that contact information would be provided to you. Contact tracing is an important tool that we use here at the Cabarrus Health Alliance, and it's also used by many other public health agencies. Contact tracing means that we ask you during your interview of anyone who's been in close contact with you during a certain period of time. Those persons are then contacted to be told that they have had an exposure to COVID-19. None of your private information is shared, nothing personal about you is ever told. So you don't have to worry that we're contacting and saying who they were around, just that they had an exposure. We're then able to educate those contacts and give them information about self-quarantining so that we can hopefully decrease the spread of COVID-19 in our community. A close contact is being defined as a person that you've spent more than 10 minutes with within 6 feet of distance for the time period within 48 hours before symptoms start up until the present time that you've been told that you're positive for COVID. So it could be someone that you live with, it could be someone you work with, it could be someone that you were in a waiting room at a doctor's office with. Anyone that you've had that exposure to, so within 6 feet of distance for more than 10 minutes, would be considered a close contact. During our contact tracing, we get the names of those people and then we follow up with them. They are then told to self-quarantine at home for a minimum of 14 days. And that's important because we know that COVID can take up to 14 days for symptoms to develop. So as we're moving forward into phase 1 of our county reopening, we want to think of ways that we can protect one another and keep our community healthy. As you go into public, we want to wear a face covering. We want to make sure that we are maintaining social distancing, so at least 6 feet apart if we're waiting in line or if you're at work, maintaining that social distancing of 6 feet. We want to make sure that we're washing our hands often. Washing hands with soap and water for at least 20 seconds and keeping our hands away from our eyes is one of the best ways to prevent the spread of any disease or germs. If you have any questions, we want you to call us here at the Cabarrus Health Alliance. You can call 704-920-1213. We have nurses available to answer questions from 6 a.m. until 11 p.m. And we just want to remember that if we stick together and we work together, we can keep our community healthy and help to just continue to flatten this curve.